Hi, I'm Dr. Andy Evans at the 66th Annual American Society of Hematology meeting in sunny San Diego, California. Really happy to be here with Dr. Mansi Shah, one of our multiple myeloma oncologists and also one of our leaders on the inpatient hematologic malignancy service. And Dr. Shah, I know, has a bit of a busy meeting involved in a couple presentations. We know it's a very competitive landscape, so to garner an oral presentation is challenging, and she's part of one for a new bispecific antibody. There's a really breaking through in hematologic malignancy. So maybe tell us about specifically this clinical trial and maybe a little in general bispecific antibodies in multiple myeloma.
Yeah, absolutely. Thank you for having me, and I'm so excited to be in San Diego with this beautiful weather. BCMA bispecifics and GPRC5D targeted bispecifics in myeloma are very efficacious agents for relapse refractory myeloma, with a response rate ranging from 60 to 70% in a very heavily pretreated population. And these are unheard of responses prior to the onset of BCMAs. But we do know that they increase the risk of infections with long-term use, and therefore the use of IVIG to prevent infections is important. And we're evaluating when should we use the IVIG, for how long, and how does it clinically impact our patients' outcomes. One of the bispecifics that we are going to be talking about at this meeting is linvoseltamab, which is the next one on the docket for the BCMA bispecifics, and a very excellent overall response rate and great toxicity profile compared to the ones that might be already on the market.
It's exciting. And you said a couple of important things. I mean, of course, we want the most effective treatment for our patients. And we're lucky at the Rutgers Cancer Institute and RWJBarnabas Health. You name the treatment, we have it, whether standard of care, of course, but also through these clinical trials. Because as you know, Dr. Shah, sometimes the only way to receive the latest and the greatest treatment is through a clinical trial, and we're thankful that Dr. Shah is leading those efforts, but also the tolerability is really important. Just one last question I want to ask about is transplant. Is that still an autologous stem cell transplant, despite these really neat targeted immunotherapies coming through? Is that still the standard of care?
It is still the standard of care in upfront newly diagnosed people with multiple myeloma. But there's a lot of competition. CAR T, there are ongoing trials to evaluate CAR T versus transplant, and actually we have one of the trials that's looking at bispecifics up front in newly diagnosed patients. So looking at one drug versus 4 drugs for patients who are transplant eligible and ineligible for multiple myeloma.
It's exciting, and that's how you move the field forward. Even if there's good outcomes, we're trying to get better outcomes, better tolerability, and it's exciting. Thank you so much, Dr. Shah.
Thank you for having me.